Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have concerns or seeking a diagnosis or treatment, please seek individual advice from a healthcare provider in your area. We are not liable for any risks associated with acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride.
Please drink responsibly and in moderation. Before drinking, please be sure to be of the legal drinking age for your country. We do not encourage the misuse of alcohol. Welcome back to Medical Media Mixer, the perfect cocktail. This is The Shot. Welcome back. I'm Tara, your co-host, and today we're doing something a little bit different. No cocktail, no pop culture pairing, no deep dive into a rabbit hole. Well, maybe a little one. This is The Shot, a quick hit on a medical news story that's been making the rounds and honestly too important to wait for a full episode. I'm going to give you the facts, break down what it actually means for you, and get you out of here in under 10 minutes because your time matters and this story is worth knowing. So let's get into it. Here's what you need to know about the biggest rename in women's health in decades. As I saw another science communicator say, PCOS got a glow up. PCOS, polycystic ovarian syndrome, is gone. Not the condition. The condition isn't going anywhere, but the name was officially changed in an article on May 12, 2026 in the Lancet. The new name is Polyendocrine Metabolic Ovarian Syndrome, PMOS. Now, I know what you're thinking. Cool, doctors rename something. Why do I care? But here's why you care. Because the name change is the result of a years-long push by patients, clinicians, and researchers who said loudly and with evidence that the old name was doing real harm. And they weren't wrong. So what's wrong with PCOS? Let's break it down. Polycystic, that word implies cysts. Pathological cysts on your ovaries. Except that's not really what's happening. The ovaries of someone with this condition don't have to have cysts in the traditional sense. What shows up on ultrasound are follicles, immature egg follicles that didn't complete ovulation. Completely different thing. The word cystic has been misleading patients and frankly some clinicians for decades. And that matters because when a patient Googles polycystic ovarian syndrome and sees the word cysts everywhere, they panic about things that aren't actually happening in their bodies. It creates confusion, anxiety, and misunderstanding right from the start. But it goes further than that. The polycystic framing made this condition look like a purely gynecologic problem, an ovary problem. But when in reality, PCOS, now PMOS, is a systemic endocrine and metabolic disorder that affects the whole body. We're talking about insulin resistance, cardiovascular risk, inflammation, mental health impacts, thyroid connections. This is not just a reproductive issue. The old name was narrowing how we researched it, how we coded it, how we funded it, and how patients understood it. And the Global Consensus Panel, 56 leading organizations, over 14,000 survey respondents, from patients to multidisciplinary clinicians worldwide, said enough. So why polyendocrine metabolic syndrome? 3 words were chosen very deliberately. Polyendocrine, because the condition involves multiple hormonal axes. Androgens are elevated, insulin signaling is dysregulated. The hypothalamic pituitary ovarian axis is disrupted. And it's not one hormone doing one thing. It's multi-system endocrine dysfunction. Metabolic, because insulin resistance is present in up to 70 to 80% of people with this condition, regardless of body weight. The metabolic component drives a lot of the long-term health risk. Type 2 diabetes, cardiovascular disease, fatty liver. This word puts that front and center where it belongs. Ovarian, because yes, the ovaries still are central to the story. Ovulatory dysfunction, follicle development, androgen production. The ovaries are absolutely part of this. The name doesn't erase that. Put it together and you get a name that actually tells you what's happening in the body. That's the goal. So does anything change clinically? Now, this is important for patients who are currently diagnosed or being worked up. The diagnostic criteria have not changed. I want to say that clearly because there's some confusion online. The rename does not introduce new diagnostic criteria. The current framework is still based on the 2023 International Evidence-Based Guidelines, and diagnosis in adults still requires 2 out of 3 of the following. 1, clinical or biochemical hyperandrogenism, that's elevated androgens, either on labs or clinically. Think hirsutism, acne, androgenic hair thinning. 2, ovulatory dysfunction, irregular cycles consistently shorter than 21 days or longer than 35. Or if your cycles look regular on the surface, but you're not actually ovulating, that counts too. 3, polycystic ovarian morphology on ultrasound. Yes, they're keeping that term in the diagnostic criteria for now, or an elevated AMH level. 2 out of 3, and you still need to rule out other causes: thyroid dysfunction, hyperprolactinemia, non-classic congenital adrenal hyperplasia, Cushing's. This is not a diagnosis of exclusion, but it does require ruling those out. For adolescents, that's important. You need both hyperandrogenism and ovulatory dysfunction. Ultrasound and AMH are not recommended in teens because that specificity is poor. Adolescent ovaries just naturally have more follicles. You don't want to overdiagnose. So let's talk about the patient side because it's not just semantic. People with this condition have historically faced delayed diagnosis. On average, it takes years from when symptoms start when a diagnosis is made. It has contributed to patients feeling dismissed, told their symptoms are just stress or just weight. The fragmented care model, sent to GYN for irregular cycles, sent to derm for acne, sent to endo for insulin resistance, has meant no one is looking at the whole picture. And that name accurately reflects the systemic nature of this condition and just how it's taught in medical school, how it's coded in insurance systems, how research funding gets allocated, how a patient explains their condition to a new provider and gets taken seriously. Words matter in medicine, they always have. The transition is being planned as an evolution, not an overnight flip. There will be a period where both names are in use. ICD-10 coding and medical record systems need to catch up, and patient education materials need to happen at scale. But the direction is set. So that's your shot for today. PCOS is now PMOS, Polyendocrine Metabolic Ovarian Syndrome, as of May 12, 2026, via global consensus published in the Lancet. The diagnostic criteria haven't changed, but the framing of this condition has, and that shift has been a long time coming. If you have the diagnosis, share this episode. If you have a patient with this diagnosis, share this episode. If you want a full deep dive, the history, the science, the pop culture hook, we'll look into doing a full episode if we can find a media piece that matches. Send us an email to medicalmediamixer@gmail.com if you have a media piece you think might work for this. I'm Tara. This has been The Shot, and I'll see you again on Monday.
Thanks for tuning in to this episode of the Medical Media Mixer podcast. If you enjoyed the conversation, don't forget to subscribe, rate, and review us on your favorite podcast platform. Your support helps others find the show. Want to keep the conversation going? Follow us on social media. We're at Medical Media Mixer Podcast on Instagram, Facebook, TikTok, YouTube, and on Pinterest, the Medical Media Mixer board.
If you'd like to support the show and help us grow, check us out on Patreon, patreon.com/Medical Media Mixer Podcast. And on Buy Me a Coffee, buymeacoffee.com/Medical Media Mixer Podcast. If you have a topic idea, feedback, or just want to say hi, send us an email at medicalmediamixer@gmail.com. You can also stream all of our episodes and find more info on our website, medicalmediamixer.podbean.com. We're available on all major podcast platforms, so no matter where you listen, we're there. Thanks again for listening, and until next time, keep mixing medicine and media.